The study I would like to present investigated the effect of choline-stabilized orthosilicic acid on periodontitis. Periodontitis is a gum disease characterized by inflammation triggered by microorganisms in the periodontal pocket that causes the destruction of the tooth-supporting tissues and can lead to tooth loss. On previous research, it was found that CS-OSA stimulates bone collagen formation and improves biomarkers of cartilage degradation. It was therefore interesting to investigate the effect of CS-OSA on symptoms of periodontitis. Patients with severe generalized periodontitis were included in the study. These patients had at least 14 or more teeth surrounded by at least one side with an attachment loss of 6 or more than 6. 85 patients were randomly allocated to either receive a capsule with the active component CS-OSA or a placebo, twice daily for 6 months. At baseline, an initial periodontal examination was performed evaluating the probing pocket depth, gingival recession, bleeding on probing, plaque index, and gingivitis index. After these initial measurements, a full mouth one-stage disinfection treatment was performed. All measurements were repeated after 3 and 6 months of treatment. 72 patients completed the study. When all teeth of all patients were included in the analysis evaluating the effects on pocket depth, gingival recession, and bleeding on probing, we could not find any significant differences between the CS-OSA and placebo treatment groups. In the subcategory analysis, we have selected a subgroup of patients with a good dental hygiene, having a plaque index of less than 4 during the follow-up visits. In this subgroup, the pocket depth of the extreme pockets, characterized by a pocket depth of 10 mm or more, were significantly lower after 3 and 6 months of treatment with CS-OSA compared to placebo. This is illustrated in figure 1. Another subcategory analysis, including teeth with only shallow pockets, pocket depths at baseline of 3 or less, shows that both the pocket depth and bleeding on probing significantly decreased after 6 months of treatment in the CS-OSA group, while not in the placebo group. The changes in the pocket depth and bleeding on probing after 6 months of treatment were significantly different between groups, which is illustrated in figure 2 and 3, showing no change in the placebo group and an improvement in the CS-OSA group. The illustrated effects of CS-OSA on the shallow pockets and extreme pockets indicate that choline-stabilized orthosilicic acid may have a preventive action against the development of periodontitis and associated tooth loss.